What if I told you there's a common antibiotic that can fight pneumonia, typhoid, and even stomach infections, but it's useless if you're allergic to one simple thing? You've probably heard of amoxicillin, but do you really know how it works and when you should or shouldn't take it? Stick around till the end. You won't want to miss this. Amoxicillin, a lifesaver or a risk? Amoxicillin is one of the most commonly prescribed antibiotics in the world. But what exactly does it do in your body? How does it destroy bacteria? And when should you be careful using it? Let's break it down step by step. How does amoxicillin work? Amoxicillin belongs to the penicillin family of antibiotics. It works by inhibiting bacterial cell wall synthesis. Basically, it stops bacteria from building their protective walls. Without these walls, bacteria become weak and burst due to high internal pressure, leading to their destruction. Forms and dosage. Amoxicillin is available in different forms depending on who's taking it. Tablets or capsules, 250 milligrams and 500 milligrams, pediatric use. 250 milligrams dispersible scored tablets, a liquid form. 125 milligrams per 5 milliliters powder, which needs to be mixed with filtered water. What is amoxicillin used for? Doctors prescribe amoxicillin for a variety of bacterial infections, including ear infections like acute otitis media, strep throat and tonsillitis, sinus infections and bronchitis, pneumonia, typhoid fever. Basically when ciprofloxacin isn't an option. Stomach infections caused by Helicobacter pylori combined with omeprazole and metronidazole, leptospirosis and cutaneous anthrax. How much amoxicillin should you take? The dosage depends on your age, weight, and the severity of the infection. Children, 50 milligrams per kg of body weight per day, divided into 2 doses. Adults, 2 grams per day, split into 2 doses. For severe infections like typhoid, children, 80 to 100 milligrams per kg per day, in 3 doses. Adults, 3 grams per day, in 3 doses. Duration of treatment. Ear infections, 5 days, tonsillitis. 6 days, pneumonia and sinusitis. 7 to 10 days, typhoid fever. 14 days. Who should not take amoxicillin? Allergic to penicillin? Stay away. If you're allergic to penicillin, amoxicillin could cause a severe allergic reaction. Also, use caution if you're allergic to cephalosporins because cross-sensitivity may occur. Other precautions. Do not mix with methotrexate. It can cause toxicity. Reduce dosage if you have severe kidney disease. Watch out for allergic reactions. They can range from mild rashes to life-threatening anaphylaxis. Can pregnant and breastfeeding women take amoxicillin? Yes. There are no known risks to using amoxicillin during pregnancy or breastfeeding. However, always consult your doctor before taking any medication. So, is amoxicillin a miracle drug? It's definitely a powerful tool against bacterial infections, but only when used correctly. Knowing when and how to take it can make all the difference in its effectiveness. Have you ever taken amoxicillin? Did you experience any side effects? Let us know in the comments. If you found this video helpful, hit that like button, share it with someone who might need it, and don't forget to subscribe for more medical insights. See you in the next video. Stay informed and stay healthy.